Yeah. Good morning, everyone. My name is Remigius Riluka. I'm the coordinator for Center for Behavioral Studies hosted at the School of Economics, University of Leicester. And I'm a local PI for the Freedom Africa Living the Way Quechua. It's a pleasure. Good morning. I'm Innocent Conforel, the head of the Economics Department and the also the coordinator of the Center for Behavioral Studies.
privilege to have this center located at CRDR. So we've been doing clinical trials for years, a lot of capacity in research, and he was my predecessor in leading that center. He personally nominated me to lead it, and I hope, Dr. you like what you've seen in the few years I've led it. And we really welcome you and hope this collaboration becomes very fruitful. Thank you.
Thank you so much. So now we go to the gist of the meeting that we have now, the launch. I will call upon Dr. Muitari to introduce the co-directors, as well give his remarks, and introduce Pope, who will give us the presentation. Welcome, Dr. Muitari.
Thank you, and good morning, everyone. Yeah, before I introduce or make my remarks, I'd like to also recognize the presence of the Minister of Health. And see Irani behind me. Irani, can you stand up? I hope Lorraine is also there. I also wanted to recognize the Kemri team also, which has been here, because I've had this only. Sophia was being mentioned. I think you can stand up so that you are seen by the rest of the delegates. Kemri research team from Clean Air Africa. Yeah, and then we had also a representative from the global LPG, Dr. Muchiri. Yeah, Dr. Muchiri is over there. Thank you, welcome. We had also invited one of the partners, whom I don't know whether she has alive, Lena Kariuki from Mukuru Panjenga Primary School. Thank you, Lena. Welcome. I'm sure now from there, before I still introduce the directors, they are very important people whom we have worked this journey with for a long time, whom I feel they need also to be recognized. And I wanted to start with the person you normally call father for House on the Air Pollution, global father, and that is Professor Nija Bruce. You can go and find out who that gentleman is. He's just going to stand for a while. This is the gentleman actually who has given us the process which we have gone through, the process of having the jobbings in the communities, the training manuals in the communities. He did a lot of work behind the scenes. Besides that one, we have a partner that we are working with, very strong partner, and that is Teachbox 625. This is the group that is trying to digitalize training to the communities. Professor Miriam Were, all the community workers will be trained through remotely. And to deliver this process, we have a team from Teachbox 625 that is standing this side. That is Professor Rupert Jones. And then we have Dr. Stuart, the other side. Now, the directorship does not actually work alone. It has also other people inside there. We have John. People have seen John. John is the program officer. John. And then, of course, we have a deputy director, and that is Dr. Rosa District. Rosa. I don't know whether we had introduced Matt. Were you introduced? Thank you, thank you. I think that's all with the introduction. Outside now, at this point, I now want to introduce you to the directorship. And in the directorship, we have 3 directors. The real director is Professor Dan Pope. He will be talking later on. He doesn't need actually to do it at this point. But I would like actually the co-director from University of Liverpool, that is Dr. Elisa Pusoro. At least Dr. Pusoro, you can say aye to the delegates because you may not have another chance. You can just say aye, yeah.
I think I need a microphone. I'll use this one. It is a great privilege for me to be here, to be welcome. It's very welcome. But something I really want to say, this is that we're launching a global health research unit. in Sub-Saharan Africa, but a lot of other people across the whole world. My grandmother in Italy, she was cooking with firewood, and she had an LPG stove next to her. And that's how I started to get passionate about this topic, and I'm really grateful to be here, and thanks you for the warm welcome.
Thank you very much, Dr. Risa. Now, at this point, I want to make my few remarks, and we don't want to water down what the director is going to say, because what the director is coming to tell us is what is this project all about. But before that, I want to take you through the journey that has led to this exciting meeting. We have come a long way. This journey actually was born way back in 2018 when Professor Dan Pope from University of Liverpool came to the Ministry of Health, and actually came with Dr. Diana way back in 2018. At the time I was the Deputy Director of Public Health, and I was more responsible. One of my duties is actually issues pertaining air pollution and health. And one of the issues, because he was doing some scrupulation for the country, he asked me one question. What is it that you are really exactly intending to do? And I never missed my words. I told him, as we are speaking at that point, the country was losing 18,000 people because of exposure to ozone air pollution. And this is a number that we really needed to tame or to halt. And remember, as we are talking now, the number has risen to 23,000. So I told them we need actually to reach into the households and make sure that the households have these messages so that they can actually get the message. Once they have gotten the message, those who can actually shift to using clean fuel for cooking and lighting, that will be a saving by itself, and that means saving life. So he asked me, how do we do it? I told him, we have developed 13 modules for training community health workers in the country. But when I look at module 13, which was on uncommunicable diseases, it had nothing to do with the reduction of air pollution. Collaboration that time. So we did the manual, we developed, and now when it was about to be launched, we handed over now to Professor Bruce, who now fine-tuned it properly, piloted, and now I want to announce that it was already launched by the last year, and the trainings have even taken place in the 47 counties to train the people who can train others. And we don't want that journey to end there, because training 130 community health workers is a tall order. And reaching also the households, all the households, because the Ministry of Health, the government of Kenya has committed itself that everybody by 2018 should have shifted to using clean fuel. It's a tall order, and it isn't that easy actually to be achieved. But we believe through use of the community health workers network, we reach all the households through community strategy. It is very much possible. But when we look at the journey we have worked since 2021, when we launched this manual and the job-ins, we have only covered 1.8% of what we are supposed to cover. It's around approximately 2,000 community health workers who have been reached. Now, a big number, around 120,000, not yet. So what we are thinking now, we have a big thinking. As we are speaking now, and one of the exciting aspects of this project, which is going to talk about, is the establishment of a center of excellence, which at that point when he came to Kenya, I talked about it as a small hub, which we thought now we better grow it bigger, so that it can also support other countries in Africa. We are establishing here at Kemri a center of excellence for household air pollution with state-of-the-art equipment. And one aspect that is making it more conspicuous, and of course we say it's a real center of excellence, is the way it is able actually to weigh the filters,
the filters, or to process the filters that have been corrected actually when we are sampling here in the field, and then is capable of actually processing using actually no human interactions, but through the robot. So it is quite good standard in that you cannot see what it has weighed. It has some interferences from maybe your vibrations or any other influence. And again, the robot actually is going to assist Sub-Saharan Africa, because the whole of Africa, we have been actually going to process those filters in the United States. So the journey has been shortened, and particularly for the 5 countries which are in this project, we start with those 5 countries. From January, no, not January, but February, when we launch the Center of Excellence, we do hope that now you'll be using the hub or the Center of Excellence to process your filters here. I talked about that one, Center of Excellence, because it's the same Center of Excellence where we want now to reach the 128,000 community health workers who are not reached, but through a collaboration whom I think the Director General will be mentioning when he is launching this project, that now we are coming into collaboration with the First Lady's office, who actually, as we are speaking, is ready to support us to see how we can reach all those households in the country through the Center of Excellence. So that collaboration is there, and we do believe that we shall actually reach those households, and the way we are going to reach those households, we believe it will be an example for all those other countries actually to reach out. Secondly, finally now, because I don't want to talk much, because the director is going to say more, is this Center of Excellence. The other unique aspect is where we are going now to launch a short course of about between 1 to 2 months. And this course we are going to mount actually is nowhere in our universities. It's only one of the universities, but for public, quite expensive there. But we are going to launch one here, and that is on health communication and journalism course, where we want now to train the journalists, or the journalists actually on accurate reporting, where they will be gathering adequate information. Whatever they report is actually based on research and data evidence, and more so to ensure that we have covered more households from various media, so that now we move our communities towards using a clean fuel. And the consequence, of course, for this country, but the Center of Excellence in respect to the training of the health communication and journalism is going to take care of the 5 countries. We will have the first cohort actually maybe in May or June. So that is one aspect. That course is nowhere. And for KEMRI, actually it has attracted also the scientists themselves. They want to be trained so that they can also be, they can be able actually, when they are disseminating their findings, they disseminate in a manner that is quite understood, and which can be captured very easily by the media. Now, having gone to that point, I now have the privilege to invite my very able director to tell you more about this project, how we came to get this project. And I want to say, because I want to look back once in 2021 December, it was on 23rd of December. I just received a call from him, and he told me, Dr. Muitari, yes, do you know what? No. You know we have won the bid? Which one? Clean Africa, of course, unit. Then I told him on 23rd, you know, on 23rd now is like we are being given our Christmas, because Christmas was just there. So we were very excited that Christmas, actually. And I remember we did this proposal at one point. I was also already very desperate, because when we were about to submit, he got also sick, sorry to mention it. But, you know, behind there, Dr. Elisa was behind in the team there in the UK, and we finalized the bid very well, and we submitted and we won. Now it is my humble request that you come and tell us about that project before we proceed with other things. Thank you.
Project my voice. So thank Through the microphone? Oh, that's it. Great. Well, I'll start by saying Karibuni Nyote. Welcome, everybody. I'm very privileged to be here, and actually, I'd just like to reiterate what Elisa was saying. Oh, thank you very much. To reiterate what my co-director, Elisa, was saying, this is very much a partnership, and I'm very honoured to be here representing the whole partnership from the UK, but also Kenya, Rwanda, Uganda, Tanzania, and Cameroon. And we've all been on this journey together. And I'd just like to say a couple of words for our Cameroonian partner. We actually started in 2015 with a very difficult task of trying to understand how we could move away from our silos in public health, trying to understand what the health impacts are of household air pollution and providing the evidence for the burden of disease, to thinking, how do we address this? How do we support communities start to adopt clean cooking to prevent any household air pollution related disease? And we partnered with Professor Mbachu from Douala General Hospital. We developed a very complex system of mixed methods implementation research, and we had a lot of challenges, a lot of things we had to overcome in implementing the research, and eventually we developed a set of methods that we thought could be taken to other settings and were very much a foundation for the work we're doing in East Africa. So I'd just like to, a round of applause for our Cameroonian partner. So I've got the honour to explain what Cleaner Africa is and some of the activities that we're going to be carrying out over the next 5 years. I have to be a bit careful because I know our funders are on the line. So it's going to sound very impactful, and I'm going to finish with a video that we've produced with our partners and also with the NIHR. And we'd just like to thank the NIHR for joining, because I know it's very early in the UK. So as Elisa says, as Nigel was saying, it's been a very long journey to get here. And Clean Air Africa is going to provide us with an opportunity to implement strategies to address the burden of disease from household air pollution by providing an evidence base to inform national policies for transition to clean energy in sub-Saharan Africa. And that's very important for us. Right. Is this one? Okay. Oh, okay. There's always technical teething issues when trying to present such a big body of work. So as I was saying, Clean Air Africa is in the unique position to take research-based evidence and inform national policy for the scale of adoption of clean energy to address the burden of disease from household air pollution. We've got a number of impactful research-based activities, but also activities for health system strengthening, because we see prevention at a community level, as Dr. Mataru was explaining, as crucial in the mission to encourage communities to adopt clean energy. So, next slide, please. And you're going to have to keep pressing it, I'm afraid. But so, 3 billion people globally rely on polluting fuels for household energy. That's charcoal, wood, biomass, and kerosene. And we now know, because a lot of the work that's been done on the global burden of disease, that approximately 2.3 million people die every year from exposure to household air pollution. That's more than HIV/AIDS, that's more than malaria. It's one of the biggest environmental risk factors for disease burden. Sub-Saharan Africa bears a disproportionate amount of that burden. 900 million people, that's 85% of the population of the region, rely on polluting solid fuels and kerosene for their household energy. Almost 690,000 deaths every year result from this exposure, and that's almost 1 in 10 premature deaths in sub-Saharan Africa from household air pollution. Could you press it again, please? Up one. I think we've heard this, but in terms of Kenya, okay. As Dr. Mutari said, more than 2/3 or 3/4 of the population, 76% of Kenyan households rely on polluting solid fuels. And in fact, as we know, in rural communities, that's more like 100%, because people can gather polluting fuels and use those for their energy. And almost 23,000 deaths now are caused by exposure to household air pollution in Kemri. It's recognised as a huge burden, and it's steering policy in Kenya. Next slide, please. Actually, one up, sorry. So other impacts from reliance on solid fuels include the degradation of forests through non-sustainable harvesting of fuel wood. And that's often the biggest driver for change in many sub-Saharan African countries, the loss of the forests. It's recognised as a priority by governments and politicians in sub-Saharan Africa, including in Kenya. The loss of trees contributes to atmospheric CO2 associated with global warming, and there's also a loss of biodiversity. In addition to burning wood and charcoal in inefficient cook stoves, the emissions from burning those fuels produces very high levels of anthropogenic black carbon. So that's a significant short-lived climate-forcing pollutant that's really important when we're considering mitigation measures for climate. Next slide, please. No. Yes, sorry. Can we go back one, sorry? So the burden obviously particularly affects women and children due to domestic roles. So many hours are spent gathering fuels for women and children, lost productive time for employment, lost educational time for children, and also a threat for violence, injury whilst gathering the fuels. So it's a real gender equality issue as well, transition to clean energy. Next slide, please. And again.
So the WHO has published indoor air quality guidelines for household fuel combustion. And in fact, our group at the University of Liverpool helped steer the development of those guidelines, largely led by Professor Nigel Bruce. The guidelines were designed to help policymakers, stakeholders and donor organisations understand how best to reduce pollution-related illness through transition to clean household energy. The guidelines set targets for key pollutants from household air pollution, especially particulate matter of 2.5 microns, so this is respirable particulate matter that's so damaging to health, but also for carbon monoxide. And these levels were set to be reached to maximise health gain and reduce the impacts from exposure to household air pollution. The level that's set by the WHO is 5 micrograms per metre cubed. Okay, it might not mean much to many people. Okay? They set an interim target level for developing countries of 35 micrograms per metre cubed, realising that it's very hard to achieve those very, very low levels that maybe we can see in higher income countries. In a household burning wood, in an open fire, cooking for their families, we're seeing levels of 500 to 1,000 micrograms per metre cubed. And when we think of the safe level of 5 micrograms per metre cubed, you get an impression of what sort of health burden this actually is. So how do we achieve those low levels of exposure? Well, the WHO, if you press one more time please, specifically recommended an urgent requirement to scale clean fuels and technologies in low and middle income countries. So these are cook stoves and fuels that can reduce the levels of household air pollution to the interim target levels of 35 micrograms per metre cubed. Next slide, please. So, the only way to reach those levels, and there's been a huge amount of empirical evidence that's been collected on the preventive effects of different technologies and fuels, is to use truly clean fuels, like electricity, natural gas, biogas, ethanol, and liquefied petroleum gas. Trying to burn biomass more cleanly in an improved cook stove will not achieve the levels sufficient to benefit health. They don't get near the 35 micrograms per metre cubed. So a real push needs to be made for scaling truly clean fuels. And in terms of clean fuels, LPG offers the best potential for rapid scale. It doesn't require an infrastructure, it's affordable, it meets the user's requirements, and importantly, the scale can be achieved with the right investment and market and infrastructure within the time frame for the UN's Sustainable Development Goals. UN's Sustainable Development Goal 7 has a specific requirement for universal access to clean, modern energy for all by 2030. That will help address the burden of disease, that will help protect forests, and that will help create gender equality. It will also help with economy and development. So if we can meet Sustainable Development Goal 7, we can also meet a number of other Sustainable Development Goals. And that's a real driver for Clean Air Africa. We want to be providing research evidence to meet the agenda for the UN Sustainable Development Goals. Next slide, please. So despite recognition of what is needed and aspirations for scaling up clean cooking fuels, it's likely that Sustainable Development Goal 7 will not be achieved by 2030. In fact, the International Energy Agency has stressed in their recent World Energy Outlook report that unless rapid action is taken, the world is going to fall short of the universal target for clean health, for clean cooking. And this is by almost 30%. So that aspirationally will achieve 72% of people clean cooking by 2030. But what it means for sub-Saharan Africa is that more than 60% of the region's population will be without access to clean cooking by 2030, without urgent action. So, Clean Air Africa fits within that space to provide evidence to help move us forward towards the UN Sustainable Goal 7 and the other benefits through other Sustainable Development Goals. Next slide, please. So I'm going to tell you a bit about Clean Air Africa and some of the activities that we're undertaking. But before I start, I want to say that we have our funders here, and I'd like to acknowledge the Global Health Research Programme that the NIHR has set up. So this is funded by the UK government, and it's using ODA funding to support initiatives, research, capacity building, health system strengthening that can really impact people's lives for the better in lower middle income countries. And since its launch, there have been a number of very impactful research activities across academic institutions in the UK, but importantly, teaming up with academic institutions, research institutions, clinical settings that all contribute across the lower middle income countries to target important health indicators and impacts. And since its launch, there's been a huge amount that's been achieved, and I'd encourage you to look at the funders' website to see some of these groups. So we received funding from the NIHR in 2018 to develop a global health research group. And that was with our partners from Cameroon, Moi University, Diana Menyer's team, and also partners in Ghana. And the idea was to try and understand how we could develop an impactful program of research and health system strengthening that could really start to
make a difference, that we could take the evidence from and through effective knowledge exchange help impact policies in our focus countries. And I think we've had some success in doing that, and you'll see a video showing some of the work we've done. And you've already heard about the community health worker training program from Dr. Matari that's been very successful in the country. In June this year, I had COVID, and I was, had COVID before June this year, but we wrote a bid for the NIHR to try and expand the work we'd started in, through our Global Health Research Group, because we saw the vision across East Africa. We had made great partnerships, and we wanted to expand our work and carry on the impact that we had achieved. So, yes, I had COVID. We were writing the bid. It was very stressful, and Dr. Matari was incredibly supportive during that time, as was, and very importantly, Elisa Pizzullo, who has been along for the whole journey and supported me. And I'd just like to acknowledge your roles again. Thank you very much, Elisa. But it was stressful, so we put together the bid. We knew it was on solid foundations, and we found out at Christmas that we were successful. But we didn't stop and celebrate. We moved straight into developing what we're going to present now, our programme for Clean Air Africa. We found out at Christmas, by the 1st of June, we were launching. We've had a huge amount of Zoom meetings, and for me, this meeting is just so important. It's the first time we've met all our partners in one space, and the next 3 days are going to prove very, very important for us in developing our programme and implementing our research and capacity building strategies. So I'll just mention that now. So what I'm going to do is take you through some key activities for Clean Air Africa now. It's a huge programme. I probably need a couple of days to go through exactly what we're going to be setting up to try and achieve. But there are 5 or 6 activities that I wanted to highlight, which I think will be of interest and will highlight where we're going. I think we can skip this slide. So the first thing we're trying to do, and this is building on the work would be for households when they do make that switch. We identified affordability as crucial, as one might expect. The cost of acquiring equipment needed to use LPG, so the burner, the regulator, the cylinder, is prohibitive. But also when someone acquires the equipment, purchasing LPG at bulk is also very costly and can be prohibitive and stop people carrying on using LPG. So we heard about a technology, pay-as-you-go smart meter technology that was being used in Tanzania and also in Kenya. And we thought this really seems to have an opportunity for resource-poor households to adopt LPG and start using it in a sustained way. So we partnered with the largest providers of smart meter LPG, and we're going to try and evaluate their model as it's rolled out across Kenya and also in Tanzania to try and understand the health impacts, the impacts on economy, household economy, and also the impacts on their behaviour, their cooking behaviours. And importantly, and I think all the Kenyans here, and in fact probably many other countries, will understand the issue of foods that take a long time to cook, like beans and githeri. And people will prefer to use solid fuels to cook those foods to save fuel. Well, we recognise that, and we're going to pilot innovations and interventions that can maybe address that, for example, using pressure cookers, and see if that can help encourage more sustained use of clean cooking with LPG. So this is our intervention component for Clean Air Africa. Next slide, please. We're also going to be conducting research to identify what we call hidden burdens from the reliance on polluting solid fuels and kerosene for cooking. These are health impacts that aren't very well articulated or documented in the literature. Clean Air Africa will be carrying out hospital and community-based research in each of its focus countries to identify the occurrence of burns, but also the context in which they occur that are related to the use of solid fuels and traditional technology for cooking, and see if switching to clean cooking with LPG reduces the occurrence and severity of burns. We're also going to be exploring associations between exposure to household air pollution, specifically respirable particulate matter, and indicators of cardiovascular disease and chronic respiratory conditions, identifying the role that clean cooking with LPG can have in terms of prevention. So that's another, that's the health component of Clean Air Africa. Next slide, please. So this is new to Clean Air Africa, the unit. In Kenya, more than 30,000 schools each consume approximately 250 tons of wood each year, hugely contributing to deforestation in Kenya. And it's similar across sub-Saharan Africa. So transitioning to clean cooking with LPG is a national priority in many countries in sub-Saharan Africa. The associated levels of air pollution for cooks, teachers and pupils is also high, way above WHO interim target 1 levels. And we've conducted some pilot work that's demonstrated these levels are really high. So Clean Air Africa will work with organisations facilitating schools to transition to clean cooking in East Africa, evaluating the environmental and health impacts from displacement of reliance on wood, and will provide an evidence base for national policies that are scaling up transition in specifically Kenya and Rwanda, and we'll see if we can translate that messaging to our other focus countries as well. In fact, these photographs were taken last week. Nigel's here making a film, a documentary, about the issue of reliance on wood in schools and the benefits that can be achieved through transition to clean cooking. And we're working with the Equity Bank Development Foundation, who are rapidly scaling up adoption of LPG or helping fund adoption of LPG with schools, and we're going to be looking at other initiatives as well. I'd just like to also acknowledge someone very important in the room here who's made the effort to come and see us. And you might see her in one of these photographs. Lina Karaoke, the principal from Kwanenjenga Primary School. So Lina has been incredibly hospitable last week. She let us come into her school, film the classrooms, film the kitchens. She's explained to us exactly what sort of burden she experiences from using wood for cooking within her school. I think, Lina, you said that the wood causes you a headache. And it's not the smoke from burning the wood, it's trying to find the wood for the school to be able to cook with. The children in Kwanenjenga Primary School turn up largely because they can get a meal during the day. And it might be beans, it might be githeri. They'll be served their meals, they're very hungry, and they'll take half of their meal and the other half will go back to their siblings to make sure that they also benefit from the food that's provided by Kwanenjenga School. If they have no wood, they have no food, and the children go hungry. So it's such an important issue. And we'll be making the documentary and sharing it through Clean Air Africa in January this year. So thank you very much, Lina. Okay. So next, please. So this is a very important part of Clean Air Africa, and Dr. Mutari's already alluded to this. Clean Air Africa, the unit, will help the Kenyan Ministry of Health through technical and scientific support, but also through comprehensive monitoring and evaluation, to roll out training for approximately 130,000 community health volunteers in primary prevention of air pollution-related disease. Community health workers each have approximately 100 households that they're responsible for, and they provide health messaging to the households and explore ways to minimise ill health. Cleaner Africa, as Dr. Matari was saying, has helped develop a training module and associated job aids, and also a method of delivery for training to not only raise awareness of the health impacts of exposure to household air pollution, but also to explore ways of minimizing the impact it has on people's health. So obviously switching to clean cooking is the answer to eliminating household air pollution, or at least reducing it to safe levels. So clean cooking will be the answer. Many households will not be able to make that transition. So the training importantly thinks about harm minimization too. So there are messages about using dry fuel, having effective ventilation, not being around the smoke when it's at its smokiest, especially for vulnerable demographics like pregnant women or people who are sick. The materials are evidence-based. They're informed by more than 25 years of work that Nigel, myself and others have done around the burden of disease and prevention of household air pollution. And the Ministry of Health have been really proactive in taking the module, piloting it, getting stakeholders together, and creating a fantastic course that now, as Dr. Matari said, has been scaled up across Kenya. All 47 counties now have trainers ready to go and start training the community health work volunteers. So we'll be trying to support that initiative as it's rolled out, but we'll also be taking the course to Uganda, Rwanda and Cameroon and seeing how we can implement it into their public health strategies as well. And that's why our partners from Teachbox, who introduced themselves, the 625, will be so important. They're helping us digitize the training and make it much more effective in terms of scale. So hopefully over the course of Clean Air Africa, we'll not only have a paper-based method of delivery, but we'll also have the digitized version that could rapidly scale across East Africa and Sub-Saharan Africa as a region. So for us, it's a very exciting initiative. Next slide, please. So, crucial to the work of Clean Air Africa is ensuring our research is both relevant and impactful in our focus countries, but also can be translated into action, can be translated into effective policies to help scale adoption of clean cooking for households, for public institutions, especially schools. We're also looking at commercial cooking as well, people who cook in the streets, street vendors. I haven't got enough time to talk about everything, but we want a full transition for everyone who experiences this burden of air pollution. So you'll see here, Bertrand, do you remember this? So we were in Cameroon, and as we turned up to do some research, the national television company said, would we go on a morning show to talk about air pollution and the damage it causes to households and the importance of clean energy. I was very nervous, but luckily they asked for it to be done in French, so Bertrand stood in and presented and did an amazing job. So we really are keen on communication, not just through stakeholders and policymakers, but engaging with media. And we are hoping, as Dr. Matari said, to set up a course in health journalism that can draw journalists from across sub-Saharan Africa to KEMRI to learn about household air pollution, about implementation of clean energy, and communicate that message to the population, but also to stakeholders. We see it as a very important medium for raising the profile of the agenda. And the last slide, please. So this is core to the goals of our funder, I guess, and we're very keen on I suppose we see it as one of the real strengths of the Global Health Research Programme. So Clean Air Africa has a core objective to create capacity and autonomy in research on air pollution and health across sub-Saharan Africa. So you've heard about maybe the capital investment we're putting into KEMRI to open an air pollution centre of excellence. This will be the first facility in sub-Saharan Africa that can use state-of-the-art monitoring equipment for air pollution. And there's a filter weighing robot that can process all the measurements that are carried out across sub-Saharan Africa to cut out the middleman, which is typically the US, where you have to rent their machinery, send the filters back to be processed in America, they come back here. This will be a focus point for measuring air pollution across the region. We're going to start off with some state-of-the-art training, and we're already hearing about international groups that want to connect to the centre, but we're saying, oh, slow down, because we need to use that facility for Clean Air Africa to implement our research. But for us, that's a very exciting flagship example of our capacity building. We've also got a cohort of 8 PhD students that are going to be managed across the partnership. They'll be coordinated maybe through the Kemri Training Centre, but importantly, each of our focus countries have at least one PhD student assigned to them that will train in-house and will build that capacity. We have lots of other capacity opportunities. I think I'll acknowledge someone else in the room. This is Matt Schupler, who's done a lot of our early training for 2018, since 2018 for the Global Health Research Group. He's got a huge amount effort with our partners who have lots of experience that we can have a collaborative effort to training. So, if you'll indulge me, we've got a very short video, and I'm going to finish with this. It summarises some of the work we've done through Clean Air Africa as a global health research group. It only scratches the surface, and it was produced with our funder, so it's about 4 minutes or so. So I'll just hand that over to Elisa if you press play. Is it sharing sound? I think if you press pause, when you share it, it needs to be... Like I said, technology often doesn't work how you intended it. So I've got to... Bear with us for a second. If this doesn't work, we'll go straight on to the next presentation and we'll maybe do it later. So if you're able to operate it from... 3 billion people across the developing world still rely on wood, charcoal and kerosene for their everyday cooking. The
resulting household air pollution remains one of the world's greatest environmental health challenges, responsible for some 3 million deaths each year from respiratory and cardiovascular diseases, stroke and cancer in adults, and pneumonia in children. Here at the University of Liverpool, our NIHR Clean Air Africa Global Health Research Group is working with the World Health Organization to support rapid-scale clean household energy, such as liquefied petroleum gas and electricity. Clean Air Africa
So thank you all for listening and for hearing me talk about Clean Air Africa. I'd be delighted to talk to you more throughout the session or later on today. And I'd like to give way now to someone who's very special to the programme. It's somebody who's helping steer our community engagement and involvement initiative, who has so much experience I can't even start to explain. So may I introduce, well, not to everybody, I think most of you know Professor Wary really well, but Professor Miriam Wary, Nobel Prize nominee.
Jambo and karibu to all those coming outside of East Africa. We are delighted that this project is taking off. I want to thank the Liverpool group. Professor Pope keeps referring you as his father. I was correcting him that you are maybe a little, you're his elder brother by 1 or 2 years. But we thank you for that respect and approachable nature that you bring to us. It makes it much easier to work together. When we think about household pollution, to the younger generation, it may look like, the younger urban generation, it may look like a far-fetched issue. But those in my age group, I'm in my 80s, we grew up surrounded by smoke. And in fact, it never occurred to me that it was possible to live without smoke. You know, you're always wiping your eyes, and you run out to cough at it, to then come back in, and so on. So some of us have actually seen the discomfort and possibly the damage that living with air pollution on a daily basis can do. To those officials who are here, thank you. I apologize that I didn't begin by saying, by listing the officials and thanking you for organizing this conference. It is my community way of talking that we are all equal. So I'm very happy that this is happening and that it is going to reach practically all of our people. I hope that in the long run, it will reach all our people. And I'm also very happy that the entry point for the CAA, Clean Air Africa, is the community. Because our experience is that for the last 40 years or so, is that the only way to reach the family is through the community. When I was doing this work on piloting on how to establish community health workers in the 70s, I was always told, oh, but it is going to be overtaken by time. Everyone is going to have a car, and everyone is going to have, so they will always move to the hospital. It's going to be very easy. And I'm sorry that up to now, that's not the reality. And in any case, over and above the issue of access to health service, there's also the social component of community health work, where you work together with people, you have partners, you have friends, you develop relationships, and it is another component of community health that doesn't always come out, but is very, very important. So I'm very happy that that is the approach that Clean Air Africa is taking to get our people exposed to clean air. When you work with communities, there are a few issues that you have to pay critical attention to. Sometimes it looks like you just walk into the community and start talking. But when you do that, usually you mess up things and you don't usually get far. So there are entry points. As we go to work in communities, we need to identify entry points. Who are the contact people that can help us enter the community in an accepted and respectful way? I have found that to be very important. And many times, whether our community health approach works or not depends very much on the entry point. Whom have you identified in a particular community to help you relate to that community? I have found that you can't just do one community entry point and apply it to everybody, because the community approach is a particular approach for that community. So finding people in the community with whom to work on the issue of helping people to work in community is a very important step. Then the second step that I have found important is the entry process. Once you enter a community, once you have identified people that help you to get into the community, what is the process for getting the people involved in what you're doing? Whether it is going to be clean air or something else. To enter a community in a way that people will own what's going to happen. Sometimes I have found that people will say, we'll go to a community with a program, like a project like clean air, and say, as you know you want this. Well, people don't know that they want that, so you're not telling the truth. So honesty and a truthful relationships with the people is very important. I have found that the best way to do is to say, what are some of your problem issues in this community? And it may be that they don't mention the issue you have come with. They may not mention air pollution as an issue. For instance, I probably wouldn't have mentioned it because it had not registered to me as an issue when I was growing up. But you can say, once they have told you what their problems is, you can also say, we have also found that air pollution, or you can use even more local language, smoke in a kitchen is a problem and becomes a health problem. This is what we have found. What do you think about it? In other words, complete honesty and sharing new ideas openly rather than putting it in the mouth of the people to say, you have said. Because people have sometimes thought that if you do that, if you say that you have said, it makes people feel good. No, it makes people feel misused. And they don't trust you anymore. Because they, what else is he saying that we are saying? What else is she saying that we are saying? So it is very important in the process that you share what you're going to do while you're also listening to the people. People don't necessarily reject new ideas, but you have to say, I think this is a good idea that we should try out, and the reasons I think it's a good idea are this, so can we discuss it? And you begin an honest discussion that helps people to see the importance of what you're saying so that they can own it honestly. I have found that when people own what you're saying because of your honesty and your truthfulness, it is easier for them to take it on. People often ask me, what is the secret of empowering people? People empowerment, because I believe that that is the key to successful community work. And it's my experience that the first step is people identifying you as an honest and reliable person. So from the very beginning, don't make it look good to them. Don't flatter them by saying, as it is your ideas, you think you're flattering them, but they actually realize that you are insulting them. Our people are very, very perceptive. Even just because they don't speak English doesn't mean they don't understand. So many workers make that mistake. So the process has to be an honest process, and people realize that, oh, this person really thinks we know something. And of course people know something. When in my early years in the medical school, I used to be very embarrassed when I took medical students to the community. He's 20 years old and he's talking to 70-year-old people, 60-year-old people. He doesn't even know that he will get to 60. And he's threatening them that so there is no point in presenting yourself as the only person. You can say, I have come to share. I have found that to be the most helpful way. I have come to share ideas that may improve our life together. But not if you don't do this, you're going to die. I would ask him afterwards, how do you know you'll get to 50? These guys are over 60. So it is important to be honest and respectful in what you're going to do. And then the third point that I have found important is the structure, the community structure that you are going to use. Once you have worked in one community, you have an idea of the structure that is needed. But don't assume that that structure will automatically work in another area. At least there should be discussion. The process of sharing with people, how do we organize our work? And I must admit that when I was doing this work in 1973, the idea of community health workers was not on the market. It was always, how do I get the nurses to come to the community to help the people do the work? But since in our discussion, most of the issues were prevention issues. How do you stop people from getting diarrhea? How do you prevent diarrhea? How do you manage diarrhea? How do you help people not getting malaria and so on? So, but our preoccupation was how do we get nurses to tell the people this? And it is the people who asked me in 1973, what can we do for ourselves since these things are prevention? And I had to run back to the Ministry of Health and say, the people are asking that they should know what to do for them. Because they said, you can train us. These are simple things. You can train us to do these things, and so on and so on. So the whole issue of community health workers actually emerged from the people. How can we train one or two of us to do these things? It didn't come from us imposing it on them. And then it became a very useful way of doing things. And when you go to a new community, you say, this community has suggested that we train some of them to do this. What do you think? And then it becomes a program. So it is very important to work on the structure in terms of the community. And then you find that, we found at least, and I think it is still true in what I have observed, that the community health worker cannot be a volunteer. The people themselves told us that this person spends most of her time working for her family or looking for food for her children, working for someone to pay her so that she can manage her family. Now, if this person is going to work for us, who is going to give her how to look after her family? And I went to the Ministry of Health and gave them this information. I said, forget that, we cannot pay them. So I came back to the people and said, the ministry cannot pay them. And the people said, well, we'll pay them ourselves. And they actually did. They organized community health fund accounts in the nearest bank account, which was in Kenya we have the post office banking system, which is very helpful because it means where there's a post office, you can have a bank. So people decided that they were going to have community health accounts, and they did, and each house was to give 50 shillings a month, or whatever amount they decided. They put it into the community health account. They chose who should be the signatories, who deposit the money, and who withdraw the money, pay to the community health worker, and also use it for community programs. So like if you're going to protect a spring, you need some cement, you need some stones. So they use the community health account for those things. People are sensible and are organized, and they don't want to exploit people. So I am very sorry to say that up to now, we in Kenya are not yet paying community health workers. It is one of the sorrows of my professional life that after many administrations in the health sector, we still haven't got one that sees not community health workers' payment not as a central issue to our health development, but a by the way issue that can be forgotten. And so you have a very high dropout rate. You train people, they are very good, but they can't live on air just because they are good-hearted. People have nothing else, and you're asking them to use the only thing they have, time, for the public good, and you're not helping them to survive. How can they stay in the system? So this whole issue of community health workers, those of my senior colleagues from the Ministry of Health of Kenya, this is one of the 20 issues that really has to be addressed, even with this clean air. And we are saying it will depend on community health workers. How will they be available? And how will they stay? How will we retain them if we haven't yet started paying them? So it is a very difficult thing. And then there's the whole business of the relationship between the community leadership and the formal leadership. I think that is already a fact that is known and possibly being worked on, and therefore it's not unique to this program. And then when you have this program of Clean Air Africa, how are we going to monitor it, and how are we going to evaluate it? Now, monitoring this program is very important because it could really make a big difference. It could make a big difference. Every village I go to, there is always cooking in the kitchen. And it is fun to stay in the kitchen. It is nice and warm. And, it's cozy. So it is very nice. But we have to understand that there are consequences. And if we don't want to pay for the price for the consequences, then we need to know what must be done in order to bring about the change. Community sharing, at the end of it, when you have an annual report and you bring together a number of communities in the same area, say in Kenya we have the administrative unit called the sublocation is the lowest unit, which is made up of several communities. It helps to bring them together to share and to advise each other. This, of course, takes a bit of money, and this brings me to the issue of the fact that the community health approach is not a cost-free approach. Sometimes the ministries get very, very worried about the fact that there are costs to communities. And I understand, because I have been in the health system, and I know that money is always in short supply, but always the cost-benefit is the issue. What is the cost of not doing that? I have found that not having effective community health services just keeps people going around in circles from one disease to another, and I think that I think I saw some people from Rwanda standing up. So there are people from Rwanda here, and I don't know if there's anyone from Ethiopia, but those are the two countries. Where are the Rwanda people? In case I make a mistake in saying what I'm going to say, I have found that Rwanda, when I visited your country in 1997, by 1997, you had already established the comprehensive community health Sindio. And from the very beginning, they said, how are we going to compensate our community health workers? In Ethiopia, they call it extension, community health extension workers. I worked in Ethiopia for 15 years in the good old past. So, and they have health extension workers who do the work of the community health workers. And they are on the payroll of the Ministry of Health. When the Ethiopian government decided to put them on the payroll, it was not a particularly wealthy country. I don't know if it is more wealthy than Kenya now. So it is always a matter of the priority. And I was amazed on how dramatically the Ethiopian indices changed. Within 3-4 years, we had moved from very unspeakable maternal mortality rates to lower levels than Kenya. Very unspeakable infant child mortality rates, so that the value, the cost benefit of having health extension workers in Ethiopia, you can read it, it is published in many countries. It was a fantastic fact. I think Rwanda was doing very well also. I haven't read it, but I think we are even doing better. So stabilize the community approach by paying community health workers. If it was my wish and I was the emperor of Africa, I would outlaw the word community health. There's a title, community health volunteers. It gives it legitimacy. It makes people feel that these people can just work and then go home with empty hands to face their crying children. I don't know about the fathers, but a mother, when you come home with empty hands, it is a very torturing experience. So please, whichever government we come from, the community health approach, including the approach for Clean Air Africa in the community approach, we need to really advocate for and get the idea of payment of community health workers accepted. So I'm very happy that you are carrying out this community health, this Clean Air Africa. It has, I had a list of some of the problems you could help us overcome by this approach, but I'm sure that it's going to come across, and I don't think I should keep you longer. I just want to end by saying I thank Dr. Mwitari very much. In my terminology, he's a very young man, but has had a very big impact on moving the health of this country forward through his emphasis and commitment and expertise on community health approach. So I wish you the best, and I hope that you'll give me the privilege of seeing a healthy Africa before I go to heaven. Thank you very much.
Thank you so much, Professor Were, for that very good speech. And actually, most of us now, we are more learned in that particular area. We used to call people community volunteers. We should stop that. I know there's some areas where if there's no smoke coming from your house, they bury you before midday because there will be no lunch there. I think we should now start moving away from smoke to mean food, but smoke to mean pollution. Thank you so much, and Professor Pope for enlightening us on that particular area. Now we move to the next. I think none of these things will happen without funding. And we have our NIHR funders, and they are online. People in diaspora, I do not acknowledge you. You are all welcome, and I hope you are hearing us very well. Dr. Sarah, are you there? And can we load your, you can probably say one word before we load your presentation? Sarah?
Thank you for inviting me to talk at your launch event here today on the 22nd of November for NIHR Clean Air Africa Unit. I'm Dr. Sarah Pellicum. I'm Assistant Director for Global Health for NIHR, and I look after the team that look after your award. I thought I'd just briefly give you some background to the NIHR. We were established back in 2006 with the mission to improve the health and wealth of the nation through research, and we very much had a strength in domestic programme management. But in 2016, we established a flagship programme of global health research, or applied global health research, which has become embedded and is a main work stream within NIHR now, funding applied global health research and research training and capacity strengthening to really meet the needs of the poorest people living in lowest income countries, and funding this through our official development assistance or UK aid funding. Now, all the programmes that we support fund high quality research, have an expectation of partnering with policymakers, patients, carers and communities to ensure the relevance, quality to the research that we fund, to help attract, support and train the best researchers to tackle complex health and social care challenges, and in global health to really ensure that all of those activities are focused on meeting the needs of those living to just show you the breadth of our portfolio and just talk through a little bit about this and how it relates to your award. So clearly, back in 2018, we funded the group with partners in Cameroon, Ghana and Kenya to really focus on one of the largest problems and risk factors for non-communicable disease, being household air pollution, and had the ambition through that group to really focus on policy relevant research to be able to address the challenges. And through rigorous scientific research and applied health research on clean energy focused on those countries, you've achieved a tremendous amount in that time. And I think back then we were really impressed by the approach you had to capacity building, and to partnership, and really how you're engaging health systems approaches to really get to the bottom of tackling those important health priorities. Now, obviously, since then, we've now funded you again as a unit, which is absolutely fantastic, and you have now £7 million and 5 years to really build on that historic work and take forward your activities. But I did want to just touch on the fact that you're part of a bigger portfolio. We have now 5 centres focused around research capacity strengthening with NCDs, with a focus on non-communicable diseases, and other strategic and thematic programmes such as our health policy and systems research and our research for innovation and global health transformation. And only the last call also in Right, we have had a focus on climate and health system strengthening. So there'll be awards coming through that scheme that may have real relevance and synergies with some of the things that you're doing. And I encourage you to think about how you might want to network across our wider portfolio. You may already have got really good connections, but there are new awards coming online all the time. So just to encourage you to think about how you might have synergies, how you may be able to work together and collaborate and be more than the sum of the parts. We also have separate capacity strengthening activities around professorships and global partnerships. And there are opportunities through any of these awards for you and your partnerships to think about future sustainability and funding and career development opportunities for those within your wider network. Now, just to take you forward, so you were funded as a group in our first phase, you're now funded as a unit in our second phase. And the focus of our strategic framework for this second phase of funding is, again, high quality applied health research to address unmet needs for people living in low and middle income countries. And underpinned by 3 main pillars, which you'll be heartened to know that you've been working towards historically through your group and achieving against. And I hope to see exactly similar things happening in terms of the unit. So we've got addressing the shifting global burden of disease, we've got developing health systems to identify and respond to those population needs, and we've got building resilience to tackle future global health threats. And underpinned across all of this is strengthening research and research support capacity, particularly in LMICs, but also in the UK. And another underpinning and strong theme is promoting community engagement and involvement throughout the life cycle of the research, and also policymaker involvement throughout the lifetime of the research, to ensure that through those equitable partnerships and networks that you can really achieve high quality, policy relevant and really impactful research. And you've made a fantastic start through your group, and I look forward to seeing how much more you can achieve through your unit. So if I move on, I thought I'd just pull together some of the achievements that NIHR have been helping to promote that you had historically achieved through your group, and how we can continue to work with you as you develop more research through your unit and the next phase of your funding. So some of the successes that I've really pulled out, and we've been truly impressed by the achievements and impact achieved to date, are, for example, your community health worker and training program that you had in Kenya, which developed in close working with the Ministry of Health there. The work that you've done with innovators to help support poor communities to help switch to clean cooking with gas, and some of your really seminal work on energy and nutrition poverty following COVID-19 pandemic in both Kenya and Cameroon. And not to forget your important contributions to COP26 around climate, health and the co-benefits of clean cooking that you presented there, as well as some of your policy reviews, for instance. So I think tremendous work, fantastic track record that you've been building on. And this is part and parcel of how we have now refunded you for, you know, another 5 years to take forward work and to extend those partnerships that you have into East Africa, and to really continue to build on that work in Kenya and Cameroon, but also to have transferable lessons for Tanzania, Rwanda and Uganda. And you know, this is a unit is a very prestigious flagship award, and I think you can make a real impact in tackling air pollution related disease, and through scaling up the use and adoption of clean energy approaches for the future, and really through education, ensuring that communities are able to be able to use fuels that are going to be able to support their future health and well-being. So we recognise the timely requirement for timely evidence and that can inform the policy agenda, particularly around clean cooking, and how we can use colleagues at NIHR. We really very much look forward to working and engaging with you through Clean Air Africa and working in partnerships with the Kenyan authorities over the next 5 years to really highlight and support you in achieving the impact and the knowledge mobilisation required, and in helping you demonstrate how your research and your research capacity strengthening is really supporting and strengthening SDG 3. And I did want to just reinforce that clean energy and air pollution is a hugely important priority for NIHR. That was demonstrated back in 2017 when our CMO really sort of made an annual report about air pollution. And just to say that in 2023, the next Chief Medical Officer's report will again be on air pollution. So you are in the thick of it, you're in the heart of the priority of a priority for NIHR and for a priority globally. And I really look forward to working closely with you and helping you on this journey. I think just lastly to say again, we've got a big wide portfolio. I encourage you to network, to identify those working in regions with you and those working on related climate and respiratory and activities, so that you can identify synergies and become more than the sum of your parts. And I think lastly, just to say, look out for other awards that we have that we are funding that could support your early career researchers, such as our Academy Awards, and also consider some of our future awards. Even if these are opening now, we'll have regular calls. So think about how some of these project awards or consortia awards may provide opportunities for sustainable options for researchers and their career development from your networks. So I think there is just the last slide on professorships which are open. Please disseminate the opportunities to your award holders. Come to us if you have any questions. But lastly, thank you so much. I look forward to working with you and to watching your progress with great pride, and all the best with your launch today. I wish I could have been there in person. Thank you very much. Good night.
Thank you so much, Sarah, for those kind words that you will continue supporting, and the award, which is not small amount of money, 7 million, the next 5 years, and we hope will not disappoint. You want to say something?
Stephanie Russell from the Department for Health and Social Care. So if anyone has any questions, she's very happy to address them now.
Any questions? The award has been given, and there are also other awards that could help youngsters improve their career.
I very much liked the last from the Global South to maybe come to UK institutions to gain their experiences in training and potentially for additional qualifications.
Sarah, are you there?
I don't know, Stephanie, if you can... oh, right, great.
Please unmute, we can't hear you. Unmute. Is there an issue on our side or her side? Can you unmute, please? Oh, probably on our side.
Maybe we could read out your response if you if you type in. We'll read it out for you. Thank you. I think we can hear you now,
We can hear you now. We can hear you now.
Yes.
Yeah, we can hear you.
Did you hear the question? Okay. So something Sarah finished on was talking about the potential for early career researchers and how they can gain additional experience through funding through the NIHR. And I wonder if you could maybe tell us a bit about how our southern partners, our global southern partners, can benefit from that funding and maybe get funding to come to the UK for additional training.
To either the UK or another NIHR award to go and further your own training in country. But that's not formal qualification as such, it's just an opportunity for those who are already funded on the award. And keep an eye out on our funding bulletins for those opportunities.
Thanks very much, Stephanie.
Thank you, Sarah. So we can move on to the next. There's a question?
So my name is Rebecca Nantanda, and I was part of the people who participated in the NIHR Global Workshop. Really? Yeah, and one of the issues that we identified with the early career researchers, especially people who are on how to continue their research journey, because most times you have to ride onto somebody like who has an international repute to apply for a grant, and then maybe you're lucky to be employed on that project. And so one of our suggestions was that if NIHR could have a specific fund which people after PhD can apply for, and therefore able to gain research experience and really go into the field of research. So I don't know how far that has gone with an NIHR. Thank you.
Thank you. Sarah, do you have any response to that?
is accurate that there's an unmet need. We haven't got any schemes at the moment, but I will take that back and discuss further with the team. Thank you.
Sir? Okay. Before we invite our guest of honor, we have our mother ministry. You can give us a very short remark. Mr. Lolem, are you in the house? Yeah.
Yes, good morning, everyone. Yes, all protocol observed, and ladies and gentlemen, good morning. I am Lolem Lokolile Bosco from the Ministry of Health. I'm a Principal Public Health Officer and the one coordinating the household air pollution activities at the Department of Public Health. And I am joined today by many of my colleagues, not two of my colleagues, Lillian Ousa here, and my colleague from the Department of Primary Health, and I would wish to maybe he will just say something after me, Hilary Chebon. Yes. So we have come here as part of the honors in terms of this is a research project that fits direct to the interventions. And when it started, we began together. And right from the time the WHO Household Energy Combustion Guidelines were launched here in Nairobi, that is when the Ministry of Health started also institutionalizing household air pollution. And that was way back in 2016 when we established the technical working group on household energy, climate, and health, chaired by Dr. Mwitari. And after his transition, we continued together, and I still hold the Secretariat of Household Pollution within the Department of Public Health, together with the Primary Health Department that owns the community health activities. So for us, we have been told that this is a big problem, and not just being told, but we've seen from the statistics that have been shown here. And the ministry has already recognized that this is a huge, huge health problem, noting that all the environmental burden, kind of is a third of all these problems are related to the household air pollution. We are being told 13 million deaths occur because of the environmental factors annually, and out of this, that's 3 million of them. So it's a third of all those. So the ministry has been really steadfast in terms of moving into putting in place measures. And one of the urgent priority that we work together with the Clean Air Africa group under KEMRI is the training guide on household air pollution, and we cannot really say thank you. That is not enough, because we still work together, because the passion within the team and within our team here is really big. We work through that passion, and following up is the huge task in regard to training these 100,000 health workers. And our other efforts has been also on ensuring that we have a clear roadmap in terms of how do we work around. And this is what we are working together with our partners, coming up and putting in place a strategy that can really guide us for the next 5 years as we move together with the Clean Air Africa under the NIHR funding. And this is really some work that we've already started. We have not only been successful if it were not because of the efforts that we've had with the initial interest that the UK friends has had with us, and that started in 2018 when Professor Dan and Professor Niger came through WHO Kenya country office, and they were able to also have that courtesy call with the Ministry of Health, and that is when the connectiveness in terms of working together with Dr. Mwitari, who was already like his PhD was in air pollution, and so he started like just some kind of something that was being awaited before, and so that's when we began the development of the household air pollution training guide that you've all seen, and we have already now started training the TOTs, and we are ready to really work around with the other 4 African countries, the Republic of Rwanda, Uganda, and Cameroon and Tanzania. We have enough personnel. We are going on to even train more, over 200. By maybe March, we should be having more trainers in regard to household air pollution dissemination to the household of Module 14. And this could not only happen if we don't have this working arrangement that has been brought by the Clean Air Africa Research Group under the University of Liverpool, Kenya Medical Research Institute, and all the partner countries. And so what we want to say as a ministry is, yes, I may not be the right person to say this, but we are really, really thankful and really, really appreciate and promise that we would continue moving together so that we can be able to address this huge health problem, climate problem, and a big environmental problem. So thank you so much, and pleasure going forward together. So just a minute, if my colleague he speaks from, you heard how Professor Were says in terms of community health, and I want him to hear his voice because he owns some of the priorities and some of the actions that we can also take forward in regard to really making this the issue of community health a policy and a real policy issue in regard to their remuneration. Thank you, and welcome, Hilary.
Yeah, good morning all. All protocols are observed. We know government follows protocols. And the leadership of this Clean Air Africa and the participants, good morning again. I come here on behalf of the Department of Primary Health and the Directorate of Preventive and Promotive. And I just spoke with the head, Dr. Salim, who is in Kwale, and has sent his greetings and apologies for not being here. I want to state that in Kenya, we have saturated our country with structures. We call them community health units. And these structures provides us with the avenues for continuing with the engagement for this consortium. And I would say that ever since we rolled out community health approach, it has enabled us to really raise the bar in terms of involving or getting people to participate in their own health. And I think we've been heavily inclined towards curative engagements. But I think with the CAA now, we can really go further and engage ourselves with the real and the true determinants of our health. That is the underlying factors. And in some discussions earlier today with Dr. Salim, he reiterated and he actually told me to speak about how we could really tweak our community health workforce to maybe around 90% of their time address the determinants of ill health. Because right now, as we speak, all our documents are more of curative, but how do we begin addressing the determinants? And I believe CAA is helping us to really go to where the problems are existing or are emanating from. So I don't want to take much time because my colleague Lolem has spoken much around the CAA and the working arrangements. For us, we are saying welcome. We are right into the households and we'll provide ourselves with the platform for doing this research, and we believe this research will generate the evidence which will be used to make the right decisions. So you are welcome. And I will convey that to the leadership, and for as long as the right documentation is followed, we will collect the data we require to come up with our policy briefs and the actual policies for the country. Thank you so much and wish you well. Thank you.
Now it's my privilege and pleasure to invite the chief guest, Professor Sam Kariuki, who is the CEO and the Director General at Kenya Medical Research Institute. His background also involves climate change. Climate change actually gives him his day-to-day work, because he works with AMR, which is different from the lungs, but they're all part of effects of climate change. Welcome, Professor.
Thank you very much. And good morning, everyone. Good morning. Yes, great pleasure to be here. Karibuni sana, for those who understand a bit of Swahili. We're really privileged as Cambridge to host this very, very auspicious occasion on the launch of Clean Air Africa. Very delighted to be really the host for such an important event. Let me first recognize the presence of Nobel Prize Award nominee, Professor Were. I see her in many, many different angles. We are in the diaspora arena, where she's our great teacher in public health, and you have heard her here. She's a very practical teacher. And thank you so much, Professor. Let me also recognize, of course, the representation of the UK National Institute for Health Research for funding this and also giving us a good background to the issues that pertain to clean air in Africa. Director Clean Air Africa, Professor Daniel Pope. Asante sana, really, for the normative work you've done previously, and definitely going forward, we know we'll gain a lot from your experience. Also, esteemed delegates from University of Liverpool, quite a huge contingent from University of Liverpool. I'm an alumnus of University of Liverpool. That's where I did my PhD. So very proud to see you guys here, and looking forward to engaging much more. Guests, esteemed delegates from Cameroon, from Uganda, Tanzania, and Rwanda. Really our regional partners, not just in science, but also in economics, in social circles. We really look at each other as brothers and sisters. Really, very nice to see all of you here. Our partners from the Ministry of Health, our mother ministry, very proud to see you here and ready to work with us to achieve the objectives of this forum. Let me also mention regarding development partners present. We've seen them on the virtual platform. Thank you for your contribution. Distinguished scientists, all invited guests, all protocols observed. I have a long speech, but I'm telling you I'll keep it short because a lot has been said already. Ladies and gentlemen, I take this opportunity to welcome all of you to the official opening ceremony of this new international collaboration on air, on energy, air pollution, and health that championing prevention through cooking or through clean cooking. Allow me to welcome particularly the Clean Air directors, led by Professor Dan Pope, Eliza Puzzolo, and Dr. James Mwitari. Thank you again, a very practical gentleman, Professor Dr. James Mwitari, and our partners from the UK government, NIHR, and not also forgetting all the PIs from the different countries that are partners in this consortium. Please feel welcome to Cambridge, and I hope we have already felt welcome. And we look at clean air as we launch it, looking at this as a huge establishment and a huge achievement for Africa, not just Kenya, but even the countries that are going to be a consortium but generally to the whole of Africa. Clean Air Africa is a partnership of clinical, academic, and research experts in environmental public health from the UK, Kenya, Uganda, Rwanda, Cameroon, all these different partners. And the 5-year program of research will deliver impactful, evidence-based research to inform scale-up of household and institutional clean cooking within the Sustainable Development Goals by 2030. It's a very ambitious goal, and we hope we'll be able to get there. It will achieve these objectives through one, of course, having what we call comprehensive mixed methods research, and including state-of-the-art air quality assessment, addressing barriers to adoption of clean cooking fuels for households and schools. Secondly, raising population awareness on household pollution, air pollution, health and prevention through national training programs of community health workforces. And we have heard a lot from Professor Were regarding how we should really treat these so-called healthcare, community health workers. And number 3, we will have high-level engagement with other stakeholders, including governmental stakeholders and policymakers, to be able to engage them really to have a practical approach in ensuring clean energy sector. Ladies and gentlemen, I know that kerosene and biomass for cooking results in very, very high levels of pollutants. And we have been taken through practical scientific research data that points to this. So you find particulate matter, you also have toxic chemicals, gases, and compounds that are detrimental to our health. Cooking with these fuels has been calculated to be like burning 100 cigarettes. I actually didn't know this until today. It's a huge, huge issue on public health. Research has shown that household air pollution also is a cause of what we call several different types of heart diseases, stroke, pneumonia, chronic obstructive pulmonary disease, lung cancer, and with emerging evidence of associations with low birth weight, TB, cataracts, and a range of other cancers. We note globally that 3.2 million people die each year. We've heard that. And we're looking into reducing these mortality rates by being able to address the issue of household air pollution through this project. The agenda for Clean Air Africa is very, very simple. We've been taken through a number of points through the our colleagues who have previously spoken here. And there's an urgent need for rapid scale-up to be able to transit to clean household energy in countries that currently rely on polluting solid fuels, kerosene cooking, with WHO stressing it is essential to expand use of clean fuels and technologies to reduce household air pollution and protect health. That's a quote from WHO. And we're looking into being able to adopt that as we move forward with this consortium and project. The Africa Energy Outlook of 2022 describes a sustainable Africa scenario, setting out what is needed for the continent to meet the Sustainable Development Goal number 7. And this envisages that by 2030, 1/3 of homes would be able to use clean cooking gas, 10% will use electricity, and 10% biogas, while 6% will use alcohol fuels, with 41% using solid fuels in cleaner stoves. In other words, improving the stoves, though they will still be using what we call the old fuels. But in order to reach these levels, clean cooking across access in our region needs to be improved to around 15 times faster over the next 8 years as we approach 2030. So this improvement is huge. It's unprecedented anywhere in the world. We must work hard to achieve this kind of goal. And ladies and gentlemen, Clean Air Africa is a clean fuel agnostic with a focus on the best available options for scaling up clean cooking that can improve health while achieving environmental, gender, and climate core benefits. In the short to medium term, for our region, the best option for scale-up of clean cooking is with LPG, that is liquefied petroleum gas. Other options, such as electricity, being a longer-term aspiration. Obviously, this needs to be done at scale in terms of affordability for families that will require to move from solid fuels to these cleaner alternatives. And this requires engagement, of course, with policymakers, those that are, of course, that are in financial circles, those that make budgets, to be able to make these fuels affordable. And I remember a couple of years back, some of these fuels, especially cooking gas, was zero rated. We hope that we can go back to some of these initiatives that were able to make cooking gas more affordable for our country and the region. Many African countries, including those from the focus countries for Clean Air Africa, have set ambitious targets for households to switch to gas for cooking. Clean Air Africa, as a project, will provide policy-relevant evidence to support initiatives to back these aspirations. The work of Clean Air Africa has already provided empirical evidence demonstrating that the substantial health and climate gains that can be achieved from meeting targets for scaled population adoption of gas for cooking, and the cost of this, if we didn't do that, including, of course, deforestation, emissions of black carbon and methane, is a big, big initiative, and it's a big imperative for us to be able to adopt these clean cooking methods. And to be able to achieve this target for universal access to clean, modern energy for health, gender equality, the environment and climate urgent action is needed right now to be able to support Africa's populations to transit to clean cooking. Clean Air Africa, therefore, will play a significant role in helping to meet this agenda by the critical 2030 time horizon. And I know policymakers listen to numbers, they listen to figures. If we can have health economists be able to come up with data and figures of the cost of not being able to implement this, then they will be able to listen. So that kind of data will drive policymakers to action. So as I conclude, let me appreciate all our guests, our partners, and friends of this great initiative, and together say that we can achieve the Sustainable Development Goal number 7 of access to affordable, reliable, sustainable, and modern energy for all by the year 2030. Thank you all, and God bless you all as we implement this important initiative, and looking forward to further engagement as we move forward. As I said, KEMRI is a primary partner and a major partner going forward. And my office, and through the board of directors, we will be able to provide all that is required to be able to make this initiative a great success for Kenya and the region. Thank you very much. And therefore, through the powers, of course, that have been given to me by the consortium, I declare this initiative, this Clean Air Africa Consortium and project and initiative officially open. Thank you. Yes, one more task. Now our great teacher, Professor Miriam Were, kindly, with the indulgence, please come over here. We have a small token of love in an African way to appreciate your contribution for this country and the global community in public health, and now going forward also for this initiative. Asante sana. Yes. Thank you, ma'am.
Wow.
Thank you.
Thank you so much, Prof, for declaring this particular program launched now. We are now ready to go, even though we had started, but now officially we have started. And before we leave, I think there will be a lunch after this, a photograph, then a lunch, and then there will be breakouts. And, but before we do that one there, I will invite Mr. Wachira to give a vote of thanks.
Good afternoon. My name is Anthony Wachira, Director of Corporate Services. I want, on behalf of KEMRI, to give a vote of thanks, first of all, to God Almighty for the life and the health. And here in Africa, we also pray about rain. So we are also happy. We have been blessed with rain. We have been having tough times and drought, but we are thankful. Also to the Ministry of Health, the chair of the directors, the DG KEMRI and management, the National Institute for Health Research for providing the funding, the Clean Air Africa Directorship, partnering countries, we have Tanzania, Uganda, Rwanda, and Cameroon, University of Liverpool, Professor Miriam Mwere, the Ambassador of Community Health, we are happy to accommodate you here, the Global LPG Network, Representative Elizabeth Mushiri, Mukuru kwa Jenga Primary Principal, Rena Jenga, the name Jenga also for Mukuru kwa Jenga. Then we also have Executive Planning Committee, the media, what we call the 4th Street. Again, we are happy for your coverage. The Center for Respiratory Disease Research, the director who was represented here, and also for hosting this Clean Air project. The LG Production for giving us live stream services, and also the corporate communication and ICT team. So thank you so much, and be blessed.
Thank you. So we will all go downstairs where we'll take a photo. After that, you can come upstairs for lunch. Lunch will be served just at the terrace. Asanteni sana.